Jaslyn Bay, co-founder of Western Consulting. Today, we are very honored to have Dr. Nelson Yan, founder of Redeye Biomedical from Taiwan, to be with us today. Okay, so we are going to find out, about the revolutionary technology that Redeye team has developed and their plan to be the king of providing toilet devices, okay, for everyone, and about Nelson himself. So before I ask further question, could I invite Nelson to tell us more about himself and what is he currently working on right now?
Okay, hi everyone. My name is Nelson, founder of Redeye. And I was born in Taiwan, got a PhD degree in electrical engineering in 2004. And now Redeye has 11 persons. The team is multidisciplinary, and we have experts focusing on different professions.
Yeah. So how would you describe Redeye Biomedical? If I'm someone who do not know about Redeye, how would you describe that?
Okay. The company was established in July 2017, and the idea is from me. And especially every time when I was using the toilet, I was wondering that there must have a lot of information in pools, in urines, but we just missed it and flushed away. I think that it's a pity. So right now we have Redeye.
Okay, so what is Redeye currently working on right now? Because we understand that what Redeye is trying to do is actually to be the essential in the toilet. Okay, so Pool Talks is actually the slogan of your company. Yeah.
Yes.
So what is Redeye currently working on right now?
Okay, we want to solve some problem that people are facing right now. Because right now, for people, they have to collect their samples, especially feces or urine, to hospital for inspection and wait for more than 1 or 2 weeks to see the report. And the way is not so easy for people to increase the inspection frequency. So we want to resolve this problem and make people to increase the inspection frequency easily for home use. So we are focusing on the markets of after hospital.
All right. So I've seen some news about Redeye. What are the things that probably you can tell us a little bit more the kind of like activities in Redeye itself that you are actually doing in terms of like marketing or in terms of new product development?
I think first of all I want to talk about Redeye's mission and vision. Mm-hmm. And I think that for us the mission is to solve the problem of excrement inspection at home. And our vision is to become the top 1 brand of optical inspection in bathroom. That would be our mission and vision. And right now we have something to do, and we have a product line to development. And even though right now we have launched the first product, but we still have our product line to development. For example, we have uric acid analyzer, urine protein, and urine glucose analyzer. Those are the same way used as our Redeye one, that all of them are using photoelectric technologies.
Where can we actually purchase this device? So like if I want to actually purchase this device as a consumer, where can I purchase it? So if I'm a medical practitioner, where can I purchase it, and how do I know that it's actually certified, things like that?
Got it. In Taiwan, people can buy our product in our authorized retailers. And in Southeast Asia, we are now building the distribution networks. I hope soon people can buy our product in Southeast Asia. And right now, Redeye is defined as a health enhancement product. In near future, we will register as a medical device.
Okay. So in terms of like, tests, have you all done any tests on this?
You mean the test?
Yeah. So is it like tested in some places?
Okay. Okay, and if we talk about the accuracy of the device, we have done some internal study, and also we have done some experiments with third party, and we find the sensitivity of Redeye is about 25 ppm of blood in water. And we are also performing some clinical tests in Taiwan hospitals. And the accuracy of the device is tested in lab. So we hope that for people to use at home easily, so people don't have to care about the accuracy and be confident about the accuracy. So it is not so easy for people to check the accuracy at home without any lab accessories. So if people have doubt about the accuracy, we would like to ask for the customer to contact our local distributors or contact us directly.
Right. So what actually makes Redeye hemoglobin detection device actually different from other tests like FET, things that we always see?
Okay, it is a very good question for us because we start this company for the beginning that we ask ourselves that we have to do something different from others. So we define Redeye as a product that for people to use do not need to collect any samples. And there is no need to use any chemicals or test strip. And also the results will be shown within 10 seconds, which is quite fast compared with current methodologies. So Redeye solution is totally different from current methodologies in market.
Okay, so what actually inspired you to actually develop a Redeye detection system? Because I think this is something that most people do not think of. Yeah, so it's actually quite interesting. So what inspired you to actually start something like this?
Okay, at the beginning of our startup, we performed a market survey for up to 1,000 persons. And we find out that a fact that there is no optical inspection solution of urine or feces for home use. I think the bottleneck would be the cost and the size. So luckily, right now we have Redeye, and I think Redeye's cost and size will be acceptable by the market.
So what is the most interesting case that you actually observe in the field whereby when you are doing testing or actually giving some to some of the, maybe you're working with some nursing home to actually test it out, things like that. So what is the most interesting and that leave you the deepest impression? Any of the case whereby from your consumer potential user? Yeah.
Okay, as I said, we have done the market research for more than 1,000 persons, the market research. And also we have elderly care facilities using our product, and the test data are more than 250 data right now. And I think the interesting cases for us right now is that the people like to use our device and they think it is helpful for their life. But we also find out something that not so interesting but serious, because we find the case study in Southeast Asia. We find out the kidney diseases and the colon cancer. They are all serious problems in Southeast Asia as well as Taiwan, China, Japan, and America. And we hope that after we have the product, we can do some good things for people in market.
Okay, so where do you see Redeye will be at in the coming year, and also in the next 3 years? Where will we be seeing Redeye?
And okay, right now we have Redeye 1, and we will launch uric acid analyzer followed by urine protein and urine glucose analyzer, which is the same way used as Redeye 1. These are all photoelectric devices. And also we are approaching the market of after hospitals. For example, self-care, home care, and community care. We also aim for the elderly care markets. So I think that we can do many things for people after hospitals.
Very, very interesting. I think we are very excited to actually, look at the new product that, Redeye will develop. Yeah. Okay. Before you venture into Redeye Biomedical, what were you doing? And, why do you decide to come up on your own to be an entrepreneur?
Okay. It's an interesting question for me. Before I venture into Redeye, I've been an R&D engineer for more than 16 years. Before, I worked for others, and right now, I want to work for myself and do good things for people.
What is the last advice that you will give to people who want to venture on their own? Because being an entrepreneur, there are a lot of benefit, but there are also a lot of downside and risks that one have to take. What's the last advice that we give them?
Okay, I think this question is about our first motivation to start Redeye. Because I think that finding out symptoms of diseases earlier and go for treatment earlier is very important for healthcare. And if there is a way to easily increase the inspection frequency without the need to collect samples or use any chemicals, we believe Redeye can be used as a pre-screening tool for healthcare to give a reference or warning for people to mind in advance. Then maybe the percentage that people find out diseases at late stage may become lower and lower. So I think this is about our motivation, and it is my advice for people that people have to mind in advance before they go to hospital. And after people leave hospital, they still have something to mind at home or community. So that's what I would say to the people. And I hope that if people have any question about Redeye and hope Redeye to do something more, we can do for them. And it's our pleasure to have this meeting.
Thank you, Nelson, for giving your piece of advice. It's very inspiring. Whatever you are sharing and whatever Redeye is actually doing, I think this is something that is very good for the world. It's a technology that we are very excited to actually see where it will become. Yeah, thank you, Nelson, for being with us today.
Thank you, Jesslyn. Thank you, everyone.
Thank you for watching. If you would like to have more of this, feel free to check out at exprenia.com.